Hello, my name is Jillian Hudson. I'm a board-certified music therapist. If you are anything like my parents, you might be thinking to yourself, what is music therapy? Is it a real thing? And I am happy to tell you that yes, it is a real thing. Music therapy is the evidence-based and clinical use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. That definition can be found at www.musictherapy.org. It's a very helpful resource if you have any other questions after this video. The education of a music therapist includes a bachelor's degree. I happen to be a UMKC Conservatory alumnus. Go Roos! So I received my Bachelor of Arts in Music Therapy. That degree consists of 4 years of both musical and clinical training. So I had to learn to play guitar. I had to learn to play guitar. Let's see, and after you finish with the 4 years of classes, you have to do a 6-month internship. So once the internship is complete, you can then sit for the board exam, and that's when you would become board certified. And you can put those credentials after your name, Jillian Hudson, MTBC. And in order to maintain the certification, the music therapists have to do continuing education, just like other health field professionals. So, music therapy in hospice. When I receive a referral for a patient, I visit with the patient and complete an assessment for that patient, and that's when I determine an appropriate goal for that person. Common goals in hospice include decreasing anxiety, facilitating pain management, increasing interpersonal support, increasing quality of life, and sometimes facilitating communication. In order to achieve those goals, that's when I use the music interventions. Some interventions include providing song choices, giving the patient song choices allows them a little bit more control over his or her environment, because oftentimes these patients don't have a lot of control at this point. A lot of decisions are made for them. So even something as simple as, would you like to sing Love Me Tender by Elvis, or should we do Wake Up Little Susie by the Everly Brothers? Even something as simple as that can allow them to exercise some of their own decision making and letting them feel a little bit more control. Another intervention that I use is instrument play. I usually bring small rhythm instruments with me, like a tambourine, egg shakers, rhythm sticks. So if the patient would like to be more involved in the music making process, he or she can choose whatever instrument they'd like to play, if any. Another intervention is song leading, which I do almost every session. And this is simply when I'm singing a song, I prompt the patient to sing with me. Sometimes I need to adapt the song by making it slower or even faster, depending on the patient's ability to sing. If the patient has a speech delay, I slow the tempo to adjust to that patient. If the patient is singing too fast or, singing the wrong words or whatever, I just do my best to follow his or her lead. I accompany them. I never try to correct the patient because it's my job to support them any way I can. So, if they want to know the right words, I'll tell them. But if they're having fun singing, they can sing whatever they want. I'm just there to support with music. Another intervention is music-based reminiscence. So sometimes a person singing a personally significant song, it can bring back certain memories or stories or emotions. And so sometimes if a song reminds them of something, it gives them the opportunity to share that with me. And I'm very happy to listen and ask questions if appropriate, and engage in a conversation just based on reminiscing. It gives them an opportunity to express themselves too. Sometimes another intervention I use is songwriting or recording a song that they would like to sing and have recorded. An example of this, during my internship, my 6-month internship, I worked for a different hospice. I was able to work at a bereavement camp for children. I facilitated a songwriting group in which the children provided me with memories of the loved ones that they lost, and I turned those memories into lyrics, and we piggybacked the melody of Hey Jude, and we kind of turned the song into a letter to their loved ones. So that was really sweet. And sometimes, though, the patient actually wants to sing a song and have me record it so that they have something to leave their loved ones. One lady that I worked with wrote music, and I simply brought my MacBook and pulled up GarageBand and was able to record those songs for her, put them on a CD, make some copies, and give those to the family for when she passed away. So songwriting and recording, that's another intervention. In another intervention that I use is providing spiritual support through singing hymns. Many patients request hymns, and they enjoy talking about the comfort that the hymns bring them. In other cases, some patients might ask for some help when it comes to picking music for his or her memorial service. I remember one case, this lady that I worked with, she had all of her music picked out for her funeral, and she wanted to have her family over for, this was the very last music therapy session that I had with her. She invited all of her family over, and she asked me to play all of the songs that she had picked out for her funeral so she could experience that music with them, her funeral music with them. So that was really meaningful and powerful. I was very honored to be a part of that. Sometimes, let's see, where am I? Oh, another intervention, music-assisted relaxation. This is helpful for patients with anxiety. It can help reduce their heart rate and reduce their anxiety. Sometimes I do a little bit of deep breathing to a song. So let's give that a shot here. Nice and relaxed. Let's take a nice deep breath through our nose and let it out. Very good. Let's try that one more time. A nice deep breath. How many roads must a man walk down before you can call him a man? How many seas must a white dove sail before she sleeps in the sand? How many times must the cannonballs fly before they're forever banned? The answer, my friend, is blowing in the wind. The answer is blowing in the wind. And we kind of imitate the wind when we do this. Take another nice deep breath. And then I kind of finish the song like that. And we do as many deep breaths as it might take to help decrease signs of anxiety. So that was the song Blowing in the Wind, by the way. Bob Dylan. Peter, Paul, and Mary too. So, as a music therapist, I am constantly assessing my patients for signs of agitation, anxiety, happiness, etc. As a music therapist, I have to be ready to help a patient verbally process emotions, end-of-life issues, any thoughts that might come up in response to music. Sometimes it seems like a patient's needs change moment to moment, so I just have to be flexible and ready to change whatever necessary. But it is such an honor to work in hospice. It's just such a wonderful service. The end of life is a very unique time in a person's life. We are there for the patients, but also the patients' families. So as volunteers, you guys can use music too, of course. Music volunteers can help us see patients who need companionship and would appreciate entertainment. You can talk to patients about their favorite kind of music. You can listen to recorded music. If you are talented and can sing or play, by all means, you share your talents. That would be great too. And thank you so much for being volunteers. You're sharing your time, your talents, and resources. If there's ever anything I can do for you, please let me know. Just very grateful to have volunteers. So thank you for listening and watching, and good luck with the rest of orientation. All right, thank you. Bye.